All right. Good afternoon, ladies and gentlemen. I'm going to be presenting on our experience in Chitungawiza, where we piloted the mobile caravan to try and scale up the PrePex device. Earlier on, there was a presentation on the PrePex, and I think it was quite heated. And as a country, we've managed to introduce the PrePex almost in all the provinces of the country. But we are grappling with the challenge of the numbers. And what we were trying to do in Chitungawiza is to look at how we can, optimize on the uptake of, PrePex circumcision on general on VMMC, right? That's the team that was involved in the pilot in Chitungawiza. Chitungawiza is 25 kilometers out of Harare for those who, for our visitors. It's a dormitory town to Harare with largely, it's largely residential, very little, industrial or commercial activities. Most of the people survive on the informal sector, right? Then, as far as the background is concerned, I think you are aware, like any other, countries in Southern Africa, we're grappling with the numbers. Our target is quite steep. As a country, it's 1.3 million. We've managed to do over 400 by end of last year. So we have a target of 900 to do between January 2015 and 2017, which is a steep, target. So there's need to explore innovative measures, and the PrePex and other, measures that the country has, employed are part of ways to try and scale up, the VMMC program. The PrePex was introduced in the country in 2013, but effectively rolled out in 2014 around March during the active surveillance that Karen also talked about. And it was made available in Chitungawiza from March 2014. And when we introduced it in Chitungawiza, that's in March, it was towards the end of March, just about 18 people were circumcised using the PrePex. The number increased to in April to 65, then 67 in May. Then in June, that's when we piloted the mobile caravan, right? Description of the pilot project. This mobile caravan is branded with the Pindamu Smart, slogan, which is the VMMC, the national VMMC slogan. And it was deployed, like I said, in Chitungawiza in June 2014. And it's available to provide placements in different, male-friendly venues like bus terminals, shopping malls, small business enterprises, and all the like. And it is manned by two PrePex-trained nurses who are supported to provide placement, who are supported by a team of mobilizers. And after placement, these clients are asked to have their removals done at the static site on day 7. And at the PrePex, the mobile PrePex caravan, they are also asked questions about their perceptions on the mobile PrePex caravan. So we had a questionnaire that we administered, and we're soliciting some questions, some responses from the clients who came for PrePex. That's the picture of the PrePex caravan, the Pindamu Smart slogan that I talked about, and some of the mobilizers and some guys waiting to get services at the caravan. That's the inside of the caravan. The caravan from inside with one of the nurses who provides PrePex services. The PrePex device, I think you were taken through that. Yeah. Then the objectives of the mobile PrePex services were really to try and explore reasons why men preferred the caravan, so as to inform, service replication and also modification, and also to review trends in terms of uptake of PrePex versus the forceps-guided method among adult men at Zengeza Clinic, right? the results of the pilot. During that period, that's June to October, you had 769 men, adult men, circumcised, both by PrePex and surgical. And of those 769, 581 were circumcised by PrePex, which was a 76%. Also be difficult to document some of these follow-ups. And, you know, where you need to link up in terms of adverse event and make sure that they are provided with the necessary service proved to be a challenge, right? What's the way forward in terms of, I mean, for the country and maybe for other countries with challenges like ourselves? What do we need to think about? What does this pilot, you know, inform us? We need to look at how we can scale up caravan services to other urban sites. Like we are looking at currently at Chegutu, which is a town just over 100 kilometers outside, 150 kilometers outside Harare, to look at how we can scale up, you know, uptake of VMMC using the device, particularly in the peri-urban areas where we have some mining, you know, some mines around the town, and to see whether, you know, men can take up PrePex services. And we also need to train more PrePex service providers as well as mobilizers so that they're better equipped to provide services to the prospective clients. And as a country, grappling with the challenge of, you know, the numbers, we also need to look at a national rollout plan to try and increase accessibility to VMM services by the, you know, generality of the adult male population. And given that in some settings, static health facilities are sparsely, are very, you know, are spaced apart, and the mobile caravan would come in handy to provide the much needed entry point for, you know, uptake of VMMC services. And you also need to think of removal of the PrePex device. Like I said, removals were being done at the static site, and you see when you plan the mobile caravan, you need to think of how those removals are going to be done. Right? Thank you very much for your time.